Can you speak to what side effects are out there, or what side effects people who might get the vaccine might deal with?
Sure. So obviously the first side effect that someone can have is some kind of an allergic reaction. And that is why it's recommended that you be watched for after you get your vaccine. They have you sit down, they'll watch you somewhere between 5 to 15 minutes and make sure that you don't have any immediate swelling of your mouth or difficulty breathing. And that happens incredibly rarely. Most people are going to have a sore arm after the vaccine. Some people will have mild fevers. Some people have had headaches, some body aches. It seems to be worse after the second vaccine. And I can actually attest to this. After the second vaccine, I felt really, really tired. I had some really terrible muscle aches, some body aches. I had a fever. And then it went away. You should not have any respiratory symptoms after either one of them. So the vaccine can certainly make you feel like you have the flu. Sometimes you can get rashes as well. That's another thing that's been commonly reported. But you should not have a cough or shortness of breath or a runny nose. You can still get COVID between getting your first shot and your second shot. And even after the second shot, you need at least 14 days for full effect. So if you develop any of those respiratory symptoms, that is not a common side effect. And you probably want to talk to somebody that takes care of you, one of your providers, to make sure that you haven't by chance developed COVID.